Millions of Americans suffer from hip and knee problems, and studies show at least 600,000 knee and 400,000 hip replacement surgeries happen annually in the U.S. So we're going to focus today on something called the Stryker Mako robot that's used in hip and knee replacements. And with more on this is local neurologist Dr. Chad Domingue. Thank you so much for joining us.
Good afternoon. What better way to honor the 2-year anniversary of Tony Stark's death than to talk about robotic surgery and technology. So I'm very excited to have this tough man, Tony Stark. Absolutely, yes.
Okay, so let's talk about this. What are the daily symptoms, for people who are tuning in, that people would be experiencing that would make them think they need a hip or knee replacement surgery?
So these are the arthritic patients we're talking about: osteoarthritis, traumatic arthritis, rheumatoid arthritis, a vascular necrosis, which is a lack of blood supply to a hip. These are people that have failed everything you and I have discussed about before: injections, physical therapy, anti-inflammatories. And so what happens as these joints, I'm holding up a knee first, but as these joints wear down, it becomes a mechanical issue. They no longer bend. And when you talk about a hip, it's a ball and socket. It no longer moves. So climbing upstairs, swelling, popping, the cricking and cracking, it's just over time, these joints just wear out, and structurally, it just can no longer maintain this function.
Right, and as you mentioned off the top, that robotics and the incorporation of that in surgeries has come really a long way. So what exactly does this robotic device do to help doctors like yourself?
Yeah, real simple. What does technology do? Eliminate human error. And that's exactly what robotic surgery does. It's really cool. You come in, you meet your orthopedic surgeon, they do a 3-dimensional CAT scan of the structure. And by doing that, they can see the abnormal bone, the abnormal tissue, and allows the surgeon to make very accurate, precise cuts, right? So you're not talking big incision, you're talking smaller. And as you look at this hardware, it allows them to make perfect alignment. It allows them to make sure that they're not cutting off too much bone, that everything sits perfectly. So it eliminates the shaking of the hand of a surgeon, eliminates having to cut something open and realizing something was not there on one scan. So it makes everything very precise, very simple cuts, and very fast. It allows faster surgery.
And share the props again that you had showing what the problem is that people are experiencing.
Yeah, so when you're talking the knee, it's a hinge type joint. So this is a replacement. You can see the metal. And so basically you're taking out all that soft tissue and you're putting this artificial metal and spacer. And so what the robot does, it allows these devices, these prosthetics, to be put precisely where they need to be. And the surgeon has to grind down a lot of this bone to get these implants. And you can imagine the margin between the healthy bone and the abnormal bone is very small. So the robot, by the mapping and the software, guides the hand of the surgeon to make these very small, precise cuts, maximize the results of these type of surgeries.
And what are the benefits when you look at conventional surgery versus something like this?
Yeah, the big benefits in the operating room: less anesthesia, faster OR time, less bleeding. But the real benefit when you look at the studies is you recover faster, which is what makes sense. You're not having as big of a cut. You're taking less pain medication. You're getting through your physical therapy faster. So at the end of the day, and look, just so viewers know, this doesn't add to the cost of your surgery. So when you get a surgeon that uses this device, it's included in your cost. But at the end of the day, it's a faster, it's a cleaner way to recover from what is a major surgery.
And how can patients learn more about this? What are the questions they need to be asking their doctors?
So, obviously a lot of orthopedic surgeons have done these surgeries for many years, but they need to talk to them, why are you or not using it? We're just giving some quick information, but they need to understand the benefits of this surgery, using the robot, what it means. Does it apply for their specific disease process? It may not, so these are the type of questions they need to ask. And, my opinion, for every patient, get multiple opinions. If one person doesn't want to use it, talk to one that does, and see what's the difference, and, do some education on your own time.
But people are always scared, they're the concern, if we go under the knife or a robotic experiment, in this case, that they may never walk properly again. I mean, what are the stats showing after surgeries like this?
Yeah, so the first robotic, again, was in 2010, so this is not new technology, but it's quite the opposite. The robotic surgery is not doing the surgery. The surgeon is. It's guiding the hand of the surgeon. So this big robot's sitting, but at the end of the day, the surgeon's still making the cut, doing this. He doesn't hit a button and then the robot does the procedure. So those concerns are actually quite the opposite. It's much more dangerous and much more risky not having the robot available.
Okay, thank you, Dr. Chad Domingue, bringing some new information, especially for all those suffering with knee and hip problems. Appreciate it.
Absolutely. I'll get back to clinic and put my helmet on and do some superhero work this afternoon.
Right, just like Iron Man. Okay, thank you.